Welcome to Medicarelism, the podcast where we make Medicare make sense. I am your host, Saranes Lejulus, and today we are kicking up an important conversation, and we call it the Essentials of Medicare. If you are turning 65, already enrolled, helping a loved one, or even if you are a Medicare agent who wants a clear foundation, this episode is for you. See, Medicare isn't just a one plan. It's a system with multiple parts, strict rules, choices that can impact your healthcare and your finances for years to come. Yet, most people are expected to figure it out on their own. So, today's episode, we are breaking it down in plain English. And a couple of things that we're going to cover today: what what Medicare actually is, the different parts of Medicare, your main coverage options, and also when should you enroll, and some of the most common mistakes people make. So with that said, that is one of the reasons why I'm excited to welcome today's guest, James Ridley, a licensed Medicare agent who helps seniors navigate options with clarity and confidence. James brings real world experience working directly with people who are trying to make sense of Medicare, avoid costly mistakes, and make coverage that actually fits their needs. So without further ado, James, welcome to Medicarelism. It's a great to have you here.
Thank you, Serenis. Great job. Great job. I
Thank you.
appreciate you welcoming me today.
All right. So go ahead. Keep going. I'm sorry.
No, you're fine. Yeah. So, again, I'm James Ridley. When it says real world experience, I started as a wealth advisor with one of the big firms in financial services, assisting with retirement plans. Just a little bit about my background. I worked also in fintech, financial technology. So I work with business owners who were looking to for e-commerce and using credit cards, different debit cards and the like. So I worked with a number of business owners across the country. Also, I started my journey into healthcare in 2017. I was tapped by United Healthcare, and I learned the business from the inside out, I guess you could say. From the start, I learned about how claims works. CPT codes are very important. We have a physician in my family, actually, who I can also, um, you know, speak with occasionally whenever there's some information that I need for one of my clients. So I bring a wealth of knowledge along with my experience, which is pretty vast, and I look forward to always helping my clients. And I also provide referrals for those who would like to speak with clients who I've dealt with. So I'm licensed in all 50 states. Again, I started at United Healthcare in 2017, moved up the ranks and became a portfolio advisor out of Miami. This is when I lived in Naples. Um, and then I've moved up to a broker. So I became a broker and representing companies like not just United Healthcare, but Humana, Aetna, Cigna, Molina. The list goes on. Devoted. I mean, there's just a number of different companies, Blue Cross Blue Shield, Florida Blue, which obviously I live in Florida, love it here. I'm actually a part-time golfer, so whenever I can, I
And I
can
would say
get
a
it.
good one too, right? You're a good golfer,
Yes,
aren't you?
absolutely. And believe it or not, I believe we see golf in Serenis's future. You may not know it or not, but yeah, you may become a future golfer. Because if you're going to live in Florida, I mean, you got to enjoy the essentials or the amenities that it provides. So yeah, with that said,
Absolutely.
yeah, I'm very excited about joining Serenus as a business partner and just helping individuals with healthcare. It's a big topic right now, and a lot of people are concerned about healthcare. So Medicarelism is a real thing. It is a real thing.
Absolutely. Well, just listen, I'm happy that you get to join us here today. Again, we are excited to start and down the path. And let's go ahead and look at the foundation and the big picture of what Medicare is. So, James, for someone brand new to Medicare, how would you explain what Medicare actually is in simple terms?
Well, so in simple terms, and it goes all the way back to the 60s when LBJ started the Medicare plan because a lot of seniors didn't even have, appropriate health care. So it was mandated by the federal government. So keep that in mind. So it's basically a health plan that's managed by the federal government. Okay. It consists of Part A, and then we have a Part B. So it allows beneficiaries to visit any doctor or provider in the US, in the United States. And that's someone who accepts Medicare, obviously. With that said, participants typically pay a deductible and 20% coinsurance for services, and then without an out of pocket maximum. So, Part A, hospital insurance covers inpatient hospital stays, care at skilled nursing facilities, and then hospice care, and then some home health care. Most people do not pay a premium for Part A if they or their spouse worked or paid Medicare taxes, and that's generally 40 quarters over an extended period. And they can tell you that with the Social Security office whenever you call, and you would receive a letter about that. So then we move on to Part B, which is the medical insurance, covers doctor's services. And this is the outpatient part of it.
Hmm.
This is medical supplies, preventative services, um, Part B requires a monthly premium. I believe it just went up recently. It's 2026 now, so don't quote me on this, but somewhere in the neighborhood of $202. Based on your income level, of course, but that's the average. And then you usually pay an amount for services, coinsurance, after meeting a deductible, and that's often 20% of the Medicare approved amount. So I don't want to get too far into that, but just to kind of give you a basic understanding that the Part A uh, covers and what Part B covers, which they go hand in hand. So you want to make sure that when you start to get this paperwork that you call myself or Seranus to make sure, you know, what do I do now? I got a red, white, and blue card in the mail. I
Hmm.
think I'm eligible. I believe I'm at the 65-year age, or I qualify based on some other, extended circumstances in my health. And so they're saying now that I need to, enroll in some type of a plan. And this is where the rubber meets the road, right, Serenus?
Yep. Absolutely. So 100% I agree with you. So let's go ahead. And I know you said a lot, but one of the things I want to do is kind of take it back a little bit, and then let's go ahead and peel the layers one layers at a time. So
Okay.
you did a good job laying the foundation of Medicare for people to understand what Medicare is and also the history of Medicare. Now, who qualifies for Medicare? Do you have to be 65, or is anyone qualified for Medicare? How do you become how do you get to the point where you qualify to receive Medicare?
That's a very good question. So typically, yes, so once you reach your 65th birthday, you're going to receive information to enroll in Medicare. That is not always the case. So, end-stage renal disease, there's other factors that people are that are on disability where the courts look at their situation and they look at the entire situation, and people are actually enrolled in Medicare a lot earlier. And those are some of the, I guess you could say, the one-off situations where they actually are able to enroll. Um, Many don't realize that they are eligible, which is the reason why it's important to call myself or Serenus to make sure that you understand the rules of engagement. And those rules of engagement, as he says, Medicarelism is important because you don't want to miss that date. Even if you're not even aware you think you're eligible, you want to make sure that you're starting that conversation early, because what can happen is once you pass that date and you don't enroll, the clock starts ticking. And when
Yeah.
that clock starts to tick, that means penalties are going to be assessed to those who don't know or aren't aware. And obviously, the saying goes, you pay for what you don't know. So this is where we get ahead of that, and we want to make sure that we're proactive in making sure that your retirement, your enrollment into Medicare is a smooth, seamless process, and that you can actually go out and play golf or pickleball or
Yeah.
travel or whatever it is and enjoy your life. I mean, that's what it's all
Yeah.
about. But those decisions are very important, because if you don't have someone like our team to help you with those decisions, it's not a real smooth one. It's not a real smooth one.
Absolutely. I agree. So, what one of the things that you did a really fantastic job explaining who qualifies for Medicare and how you get to the point where you qualify for Medicare.
Right.
And now let's take a step back. Now, like you said, Medicare has many parts to it, and for a
Correct.
lot of people, speaking Medicare is like a whole different language. Like you kind of have to learn that, and
This
not
is
only
true.
that, for a lot of yeah, right. And with Medicare, sometimes I feel like the government or the ecosystem, which is why the podcast is called Medicarelism, because it is a system. It's not just one person. You have many players that are
Correct.
involved in the ecosystem of Medicare. So, within the ecosystem of Medicarelism, let's talk about the different parts that are
Okay.
involved. Now, I know you briefly touched on that, but let's go ahead and slow it down a little bit for the average person or the someone who's new to Medicare. Let's go ahead and break it down to different parts. So we're gonna start with part A, what it is, and basic terms, and then let's start with that, the different parts of Medicare. So what are the different parts? So if we could give a brief overview of the different parts of Medicare.
Okay. So we'll call this laying the foundation, basically,
Yep.
and understanding
Correct. Yep.
Medicare, the topics.
Mm-hmm.
So obviously, there's Part A I mentioned earlier, which is the inpatient. There's Part B, which is the outpatient, doctor office visits and everything else. And then we have what's called a Part C. This includes your like the dental visits, ancillaries. So basically, we're talking dental, vision, and hearing, which obviously
Mm-hmm.
that's another important component. Many are confused about how that works, but we'll get there. And then we have Part D, which is extremely important. This is we're talking about their medications. D
Mm-hmm.
for prescription D drugs.
Yep.
So your Medigap, you also have, and then initial enrollment period of the basics when you can
Yeah, we'll,
enroll
we'll
and
get there. Yeah, we'll
yeah,
get there just a minute. So when we look at the part A, so if someone is new to Medicare, so normally you for most people, and I know you mentioned that you need the fully credit um for you to
40 quarters.
qualify.
Yes, correct.
Yeah, fully quarters, yeah, for you to qualify for Medicare. So when you look at part A, and for most people, part A, they automatically qualifies for that. Would you say that's the case for most people who qualify for Medicare?
Correct. Correct. When they are eligible, the 65 age is coming up, or the disability allows the
Mm-hmm.
judge's ruled that they can, accept or be on Medicare. Yes. That's the simple part. And there's no
Yep.
fee for that particular the part A.
Absolutely.
But for the
Now,
part
if they
B,
want to have what we call, yeah, go ahead, yeah. So if they want to
yeah,
have the complete Medicare, or at least the the surface level with Medicare, then they also need to take an extra step to apply for Medicare Part B. Is that it? Do you automatically get Part B, or do you have to apply for that?
So I've seen cases where people receive information with their card, the red, white, and blue card,
Hmm.
and they'll usually apply through Social Security. So there's and I don't have the phone number in front of me, but there's a phone
Yeah, I
number
think
that
it's one. So yeah, they would have to call 1-800-772-1213. That's the number
that's
for
the
Social
one.
Security.
That's
Yeah,
the
eight
one.
hundred 772 1213. Go ahead, keep going.
And again, Serenus or I would be help more than glad to be on that call.
Hmm.
It is a call in which the representative will ask, are you okay with Serenus or James being on the line because we're going to go through some, uh, information, and this is
Hmm.
obviously per HIPAA. So with that said, um, we're trusted advisors, but we want to make sure that you're comfortable with us being involved in that. So when you go to find out about the Part B, they will check the records to make sure that you are eligible. Once they confirm that, yeah, paperwork will be issued if needed, or they'll issue your card and let you know that you'll be receiving a card that has the Part A and the Part B on it. And once you
Hmm.
get that stamp of approval, um, with a date that states your effective date, you're ready to go. You're 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 essentially almost there. So, again, we try to make it as a seamless process as possible. So yeah, go ahead,
Okay.
Serenus.
All right, perfect. So very good. All right, so we have that, and the last thing, and I know you briefly touched on that, and then you have the Part C that comes along. So that's like another extra step. So once you get to that part, again, you have to make a decision. Once you have Part A, Part B, then you have to decide if you are gonna remain with original Medicare, and then or if you're gonna take the extra step to get in Part C. So go ahead and explain the Part C, what it is, and what does it include normally? What's included in Medicare Part C? What is it exactly?
Correct. So this is and consider this Medicarelism 101.
Hmm.
We are very heavily regulated by the Centers for Medicare and Medicaid. So there's certain things that I will say, but I would highly suggest that you call us to get more information because I'm just really going over the basics. And this is
Right, right,
more
right.
informational for everyone who are
Absolutely,
listening.
yes.
But we want to make sure that that you're, as Serena says, we want to make it as simple as possible. So with that
Hmm.
said, so I mentioned Part A and then Part B. So Part C, a lot of people aren't understanding the fact that there's what's called the Medicare Advantage plan. And this is where
Yeah.
those companies that I mentioned that the carriers, and we'll use UHC as one, they have what's called the Medicare Advantage plan. Some people have a skewed impression of what that is. Some people
Hmm.
don't know what that involves, and
That's
some
true.
people just assume that, I heard some things about it. Well, everyone has Google. Everybody becomes a Google specialist, and then they're
Yeah,
making up their own decisions based on information that they don't know how to assess it correctly. So
that's
when you
true.
make decisions like that and you don't call a licensed agent or broker or advisor like ourselves, then you're going down a road that is not going to bring some good returns. And I'm going to
Hmm.
say returns as in what your outcome is. So when I say Part C, that's your ancillary, your dental, your vision, your hearing, which are all important. And Medicare Advantage basically comprises the A, the B, and your C coverage along with D
Hmm.
coverage. And that's where we come up with Medicare Advantage. Now,
Hmm.
it's not for everyone, and it depends on, again, your lifestyle. So I used to live
Yes.
in Naples, Florida. And these individuals, they have concierge doctors. They have individuals that they want to see when they want to see them. And I understand that. And
Yes.
so I was able to help individuals into what we call the Medigap plans.
Yeah.
So they pay a higher premium,
Yeah.
and those vary based on which plan that they want to go into. But it's a decision that's always tailored to your health, number one, your healthcare needs, and what's important to you. And we're always going to ask those questions based on a needs analysis.
Absolutely. And speaking of which, and I know you briefly touch on that. Now with Medicare, we mentioned that we can't stress that enough. Medicare is not a one size fit all. It
Correct.
depends on
That's a
your
good yes.
needs, your lifestyle. Yeah. So basically, it's needs and lifestyle, and some other things that determines which direction that you take. But Medicare is not a one size fit all. And with that said, I know you briefly talk about that. What is a Medigap plan, and how do people get it? How is it different? What's a Medigap plan?
So the Medigap plan usually has a higher premium, and this plan is typically has a deductible, and there's
Hmm.
typically no network, so you can see doctors. So it's an enhancement to your Medicare basically, and with being an enhancement to your Medicare, this plan is for the lifestyles of individuals who've worked in some industries that they've done well in life, and they can afford to pay, a higher premium and see any doctor that they'd like to see. So there's different plans that, again, that's not a one size fits all either. But in this plan, when we talk about in a comparison to a Part A or Part B, along with a Part C, this
Hmm.
plan for your dental, your vision, or your hearing, or ancillary benefits, typically you're going to pay when you go to see the doctor. You'll have the red, white, and blue cards. You'll have your Medigap plan, but you're going to pay a little bit more for for the um, the dental service, for if you got to see a doctor about your hearing, or you need to see a doctor about your vision, and you can afford to pay for those. However, for your Part D, that's a separate entity in which you're going to pay a premium for your Part D premium, for your Part D medication, and then along with that, that plan works together with someone again who is willing to pay a premium and has a company sometimes has a program where they want you to enroll in a plan such as that. So that plan is a little bit different, and you also have like gym memberships, which is important to those people who play pickleball, again, or
Hmm.
golf, or some other activities, and they want to go to LA Fitness or some other gyms, and they want to continue to be proactive about their health. So that
Perfect.
the Medigap plan is a little bit of a difference. And again, it's not a one size fits all either. But those individuals typically know that plan, and that's when I was in Naples. Those are the plans that they were choosing to enroll in.
Exactly. And just to add to what you just said, with the Medigap plan, it's about flexibility and freedom. So
Correct.
when you have a supplement plan, so and I know you mentioned that. So when you have Medicare, generally speaking, Medicare, the government will only pay up to 80% of your medical expenses.
Good
So
point. Yes,
because Medicare will pay that 80%, there's a gap between 80 to 100 of your medical bill. So that's the reason why they call it a Medigap, right? So the
that's
Medigap is
correct.
responsible to cover what Medicare, your actual bill, and then what Medicare doesn't cover. And you have that. And again, again, this is a series. We're going to be coming back again to
Yes.
Medigap plan. So, but I know you just wanted to give a brief overview of what a Medigap plan is and how it works and what it does for you. Now, I
Yeah.
know we have just a short few moments here left with the podcast, but let's say I have Medicare, I have my Medicare Part A, and I have my Medicare Part B. When do I get to enroll? How much time do I have? When does it start? If I want to get Medicare, when does the clock start? For me to get Medicare, and then when does it end?
That's a good point. So Typically, and we'll just use an example, which you have 3 months that if your birthday, for instance, is March 1st and it's
Mm-hmm.
January, this is the perfect time, and it is well, we just went into February, but, per January would be a great time to start to call a licensed agent like myself or Seranus to get enrolled. Now, keep in
Mm-hmm.
mind that you've got that 3-month period to enroll for March 1st. Once you enroll, um, your effective date would be March 1st,
Yep.
okay? And so with that said, um, once you hit that March 1st date, we're gonna ask you questions like, "What's your doctor's name? What's your primary care
Mm-hmm.
physician?" Or if you have a, concierge doctor, whoever. We wanna make sure that we're looking at things like, and not to get too far into that, but your
Yep.
doctors are covered under the plan. We wanna look at your prescriptions, what things are most important to you. I didn't touch on this, but this has become a very, popular thing right now is over the counter.
Mm-hmm.
Am I eligible to receive any extras? Like, are you going to help me pay for healthy foods because I qualify for that? So we're going to
Yep.
look at all of those things and tailor a plan based on that information. Um,
Yep.
Once you hit that March 1st date, that's your effective date. So basically, you have that 3-month period. Um,
Mm-hmm.
After that, we want to make sure that we're having those conversations earlier on, even if it's 6 months before. We can put you in our calendar and start to have those conversations very, very earlier on. But what we don't want to do is not get you enrolled or have
Mm-hmm.
you wait and go 6 months after when that clock has already started ticking once your birthday has already hit on March 1st. And that was an example based on, someone who wanted to get started early. And I have many, many beneficiaries who are on top of it. I mean, I was amazed, like, wow, she's or he is very on top of it. Ask the right questions. What do I need to do now, James? Am I good right now? When will my cars be mailed out? Should I stick with this plan or that plan? And so we answer all those questions for you based on that information. And
Perfect.
so,
Yes,
Serenus,
sir.
if you can kind of delve, I left a little bit there for you to kind of cover as well. Um,
Absolutely. So just to basically, again, with looking at the initial enrollment. So with Medicare, once you get Part A, you get Part B. Then you usually have a 7 month period. So that'd be like the 7 months basically starts 3 months before your the month you turn 65,
Correct,
and then it ends 3 months after the month you turn 65. So that's
correct,
what they call a 7 month period. So let's say if you're turning 65 and let's say 3 months from May, let's say May. So if you're turning 65 in May, we are now in February. So you literally 3 months before the month you turn 65. So you can start applying for Medicare if you want to do that. So if you want to enroll into a Medicare plan, you can enroll into a Medicare plan that will be effective for the month of May because you turn 65 in the month of May and then you 3 months out to the month that you turn 65. Now, let's say for one reason, so if you enroll into a Medicare plan, the plan becomes effective the month you turn 65. So 3 months out, and then it will be effective for the month of May. Now, if you did not enroll into a Medicare plan during that 3 month period, you can enroll the month you turn 65, or you still have 3 months after you turn the month of
correct.
65 for you to enroll into a Medicare plan. And then well, also with Medicare, when you enroll into a plan, it always become effective the first day of the month, the following month. So if you enroll in a Medicare plan during the month of May, February usually becomes effective the first day
Well,
of March,
correct.
the month after. So the first day of the month after. So again, that's why we right now we're only looking at the initial enrollment basics. Again, there's more to come to that, but we just wanted to give people lay out the foundation so that people have a basic understanding of Medicare. All right,
Right.
James. Listen, I'm happy that we get to have this conversation here because as someone who's been helping high end clients and working with people again, you've been in the retirement financial services or financial planning space for a long time. Why understanding Medicare matters for financial and health decisions? Again, we want the person who's looking at the listening or watching the podcast, why understanding Medicare matters for financial and health decisions.
Well, I'll put it in a short sound bite, and everybody's heard this before. Health is wealth.
There you
So,
go.
in the old adage of individuals or clients that I dealt with in wealth management, we had a saying, and this was a question that we would ask some individuals, and it's not an unanswerable question, but at what rate would your investments need to be at in order for you to retire um, with a certain amount of money? So when we ask at what rate, um, what kind of return are we talking about?
Hmm.
No one knows what our exits, our exit date is. So we don't want you to run out of time or out of money, and then you don't have enough time to make that back up. So the key factor is in the health plan is to make sure that I've had people to say, I have part A, I think I have part B, and I go to try to enroll them and they're like, well, you don't have part B yet because you're not eligible. So then
Hmm.
that's where we come in to help make sure that we're filling that gap. So to speak on I've spoken on the wealth side because
Hmm.
once you're investing money and your money is growing at a certain length of time, you kind of have an idea as to spreading those out, those contributions that you receive. With healthcare, it's a little bit different because people's health changes over time. I mean,
That's it.
10 years from now, you become a person who has some chronic illnesses, and it does
Let's
happen
go.
based on
Yep.
stress and other things. So then we want to make sure we're looking at other components that you qualify for, and people aren't aware. You know, chronic. What does that mean? So that's a chronic special needs plan, and it just means that you have access to additional coverage that you weren't even aware of. But if we don't ask those questions, we won't even know. So when I say health is wealth, it's extremely important. I would say health is even more important than the wealth part sometimes because you can make up the wealth. You can't make up the time,
Yeah,
but if you
that's
have the
right.
right health care, you'll be here to enjoy, the fruits of your labor.
Absolutely. Thank you. And I think you touch on it exactly what I think people need to understand. The reason why it's important for you to understand Medicare, why that matters, because I think, James, you said it perfectly. Your health, for most people, your healthcare needs change. So when it's time for you to make the decision as far as how or what type of coverage you're going to get when it comes to your Medicare, it's important for you to understand. And that's one of the things that I wanted to for people to understand, that understanding Medicare is important because it affects your financials. It also affects your health decisions. So the better understanding you have about Medicare, how it works, and all the different parts and how they work together, the more empowered you will be to make the right financial decisions moving forward. So, and also encourage people, don't make long-term decisions based on short-term circumstances, right? So,
Correct.
especially
Yeah.
when it comes to Medicare. So, if you, which is why, if even if you have a good understanding, why would you recommend now? Obviously, Medicare decision, people can make the decision, by themselves, obviously, and connection or collaboration with their family members, families. But why is it important, James, for you, for someone who's looking to make a health, Medicare decisions? to reach out to a licensed professional when it comes to the Medicare decision. So, what maybe even if someone can make the decision by themselves, why would you recommend that they even have a conversation with someone?
Well, that's a good question. And so, based on our extensive backgrounds, Serenus and myself, and having worked in financial services, it's the same as picking investments. I mean, there's the do-it-yourselfers, but two heads are always better than one,
Yep.
and that's been a proven fact. Two heads are always better than one, and when you're looking at this, the changes are sometimes they're coming out so fast that
Hmm.
the end user, the consumer, the beneficiary aren't even aware.
Yep.
So I would hate for you to make as you said, a long-term decision that's going to affect your long-term. Short-term decision that you didn't educate yourself on. You don't have a trusted professional who knows the
Hmm.
business, who is he's in it every single day and fighting for our clients to make sure that they have the right health care. So different plans bring different outcomes. And you may think that you're aware or know what those plans are, but I hate I help those individuals who call me and say, guess what? I messed up. I
Yep.
chose the wrong plan. They're not taking my doctors, my medications aren't covered. And
Hmm.
boy, are those medications expensive when they are not covered.
Expensive.
There's no, there's no way out. However, the proof is in the pudding. And so this is a situation where, as Serena said, within that month of January or February or March, if we can get you back on the right track, as long as it's a specific period that you qualify for to make those changes, there's a silver lining there. But
Hmm.
that's not always the case. I've seen
Yep.
some people have to wait 6 months before they could make any changes. And I know that was a very difficult decision. So why is it important to call on one of us? I've completed all my continuing education credits. I'm looking at this from an aerial view, and I am looking at this to make sure that we all win. My clients,
Hmm.
their families, this affects everyone. And I don't want to leave out the fact that there are some people in military who also qualify for certain things, and they feel like, I'm good where I'm at with just the coverage that I have. Again, two different plans can cohesively work together, and you're not
Hmm.
even aware sometimes of the benefits that you can receive having a civilian doctor as well as a military doctor. So
Yeah.
you can get a second opinion from that standpoint. So that make sure that we are, and I salute and thanks for your services to those veterans who are out there who also, um, we don't want to leave anyone out, but we want to
Hmm.
make sure that everyone is covered properly. So a long-winded answer to your question, but I want to make sure um, we want to do this in a way that it benefits the people who've spent long years for this time to come.
Absolutely. Well, James, listen, I am so happy that you had to, you were able to join us here today. And so again, we want everyone to know Medicare isn't a one plan. Um, Understanding the basics will set you up for smarter choices for, for years to come, because it's your health matters, your finances matters. So understanding Medicare and have a good grasp on what Medicare is and how it can benefit you, we believe is very important. Now, obviously, people can get in touch with you because that's what you do. You not only help local retirees navigate Medicare, you also help people throughout the country navigate, because I know from experience that you do have a very wide range of clients, not only locally, but also throughout the country. So if anyone is looking to work with James, so you can look below in the description below. You can just scroll down, click on the description portion of the podcast. You're gonna get his email, or telephone number if you want to reach out to him if you have any questions, or if maybe you or a family member that you know is getting ready to make decisions about Medicare. Maybe you're working and you are exploring or thinking about Medicare or retirement. Now is the time for you to have that conversation with someone who
Absolutely.
is knowledgeable, someone who stays on top of his game when it comes to the education and Medicare, everything that you need to know. And I'm sure that you'll have more information. But again, we want to thank you for tuning in to Medicarelism, where we make Medicare make sense. So again, we're going to ask you for a favor. So please do us a favor, go ahead and subscribe so you get more clear, practical Medicare education. So, also, if you have questions for James, now is the time. You can leave the questions in the comment, or again, for more information, by any means, we want you to look into the comment below, and then you can get his information about himself, and you can also have different ways that you can contact him. All right, James. So, any last comment that you want to make? Anything that you want to say before we call it a day for today?
No, so I want to just say that we covered quite a bit of information. Always follow up, and we're always here to help those individuals who would love to use our services. And even if you're a skeptic, I'd love to talk to you too. But at the same
Absolutely.
time, my goal, my passion is making sure that I follow through on that subject I mentioned, health is wealth. And I've seen clients benefit tremendously, and I want to continue to see that. And that's the reason why we're having this discussion today. We can't talk about it enough. So thank you for the opportunity to speak. And now it's going to be a time to listen when the phone starts ringing.
All right. Hey, again, thank you very much, James. We definitely look forward to having you next time. So, again, thank you very much for tuning in. Thank you for watching. And also, thank you for subscribing to the podcast. Don't forget to click the like button, the follow button, and also leave your comments and questions below. And we'll be happy to get in touch with you. And until then, stay safe, and we'll look forward to having you next time. Thank you. Bye.
Yes. Thanks.